Well, I think there's a general consensus about how the system in London needs to change, and I think actually there's been a consensus over the last previous 20 years actually about how London needs to change. So you need to look at what are the root causes of the problems that we are facing in London and those that we faced over the previous sort of 10, 20 years. And I guess they fall into three categories. One is the nature of our provider landscape. We've got a provider landscape in London where we've got a significant number of hospitals which either clinically or financially or in most cases both are unsustainable in the medium term, and that requires significant service change. And we know that if we're able to deliver that, we'd be delivering much better care for patients and also save lives. We know that the population health as a whole in London, when you compare it to other parts of the country, is significantly poorer, and the number of reasons for that's to do with the nature and diversity of the population, the churn, so the number of unregistered patients and so on. And the last issue that we've got to address is the huge variability in care, so variability in secondary care, but also variability in primary care. So in London we have the best primary care in the country, but we've also got a significant amount of primary care where simply the outcomes would not support an assertion that that's good enough and we need to improve.